Hello, my name is Saj Rambab. I'm one of the respiratory therapists at Morlen Health.
And hello to you. I am Ed Birnbaum, also a respiratory therapist with a Morlen Health home-based pulmonary rehabilitation program.
Thank you for visiting our pulmonary rehab educational series. Breathe Better 101. Our topic for today is nutrition and lung health. Why is nutrition important? Your body needs food as fuel to perform all activities, including breathing. The right mix of nutrients in your body can help you breathe easier. Good nutrition helps the body fight infections, and breathing requires more energy for people with COPD. A person with COPD or chronic lung disease may burn up to 10 times more calories during breathing than a healthy person.
Right. And it turns out that breathing takes work for people with chronic lung disease, and so does eating. So a vicious cycle is where it's hard to eat because it's hard to breathe. And if you're not eating well, you're not getting enough energy to breathe well. But what we want to do, and this presentation is going to lay that out, how to improve both to turn all of that into a virtuous cycle where you're getting more energy because you're eating better and you're breathing better, so you feel more like you can eat well. So let's move on and see how we do that.
How does food relate to breathing? So metabolism is the process of changing food to fuel in the body. Food and oxygen are changed into energy and carbon dioxide. Carbon dioxide is a waste product and is exhaled. So when you breathe out your carbon dioxide. And you use energy for all activities from sleeping to exercise. So food plus oxygen gets combined and turned into energy plus carbon dioxide. Nutrition guidelines. So the big thing is we want to maintain a healthy body weight, and a registered dietitian can tell you what your goal or ideal body weight should be and how many calories you should consume per day.
And the goals will be, I mean, that's overall the goal for everyone, okay, to maintain a healthy body weight. What that body weight should be. Should you be gaining weight or losing weight? Those are individual goals. They'll depend on your diagnosis. They'll depend on some particular things that your provider and a nutrition specialist, a registered dietitian, can help you set the correct goal that's right for you.
Optimal body weight for feeling best. So if you're overweight, your heart and lungs must work harder, making breathing more difficult. Exercise regularly to limit total daily calories. So really, if you exercise more, and you limit your calories, you'll also burn calories, so you'll be in a little bit of a calorie deficit. Now, if you're underweight, you may feel weak and tired and more likely to get an infection because you don't have enough calories or energy to fight off an infection. So it's important to consume enough calories to produce energy and prevent weakening of respiratory muscles. But it's important that you get high quality calories.
Right. And once again, as you can see, some people are underweight, some people are overweight. Uh, the right uh, the right answer is what's right for you. But either way, by the way, exercise is good either way, whether you need to gain weight or lose weight or maintain your current weight. Okay, so of course, burning more calories through exercise can help lose weight, but exercising regularly can improve your appetite and will make you stronger. If you add muscle, when you lose too much weight, you're not just losing fat. You may have burned up all your fat and then you're burning muscle, you're burning protein, and then you're getting weaker, which makes it harder to breathe well and harder to eat. So exercise can help correct both of those situations. Once again, we're moving from a vicious cycle downward to a virtuous cycle upward or forward.
Other nutritional guidelines, so you should monitor your weight. If you have an unexplained weight gain or loss of 3 pounds per day or 5 pounds per week, notify your doctor, your provider. Diuretic or fluid pills, pills that make you lose water. They also make you lose weight. May need to take potassium supplement. Also, ask your doctor. Food and pills high in potassium: bananas, orange, potassium, potatoes, tomatoes, asparagus. So you also have to watch those. And steroids can make you gain weight as well. So drink plenty of fluids. 8 ounces, 8 ounce glasses per day. 6 to 8 of those. Non-caffeinated beverages best because caffeine can have a diuretic effect and helps keep mucus thin and easier to cough up. Again, the caveat with the drinking of non-caffeinated beverages and fluids, make sure you talk to your provider about that. If you have an element of congestive heart failure, they might want you to limit your fluid intake.
That leads to a very important point too. A, a sudden or a rather rapid gain in weight could be due to water. You're not gaining 5 pounds of muscle or or fat either in a day or two. If you have a rapid gain in weight, let your provider know, because it may be that you're retaining water. Now, you may or may not see swelling in your feet or your legs. You fill a container fills from the bottom upward, right? So we often see fluid in the lower extremities, as we call it, or just your feet, your legs. But any big change in weight, especially a rapid one, let somebody know. They may need to do something about it to get that water off you. Okay, even if that's never happened to you before.
Importance of vitamin D. Experts recommend taking a daily intake of 600 international units of vitamin D up to the age of 70. Men and women over 70 should increase their intake to 800 international units daily. And the Institute of Medicine recommends no more than 4,000 international units per day for adults. And vitamin D can be obtained from supplements or vitamin D rich foods such as egg yolks, saltwater, fish, liver, and fortified milk, and also the sun. And if you live in the Pacific Northwest, we know how difficult it is to get enough vitamin D from the sun. So most people will be on some form of supplementation along with dietary enhancements.
That's right.
Now, oxygen use while eating. Wear your nasal cannula while eating if continuous oxygen is prescribed. Because eating is an activity, it is an exercise basically, and it burns calories. So if you're burning calories, you should wear your oxygen if it's ordered for you continuously. Eating and digestion require energy, and your body will need oxygen there as well. All those types of activities use calories, expend energy, and if you do use oxygen, it's recommended you wear your oxygen while you're eating if it's ordered continuously.
Right. And elsewhere, I think a little later on, we're going to talk about other things you can do so that you're breathing better when you eat. But we'll get to that. Besides using your oxygen if you need oxygen.
So eating right do's and don'ts. So include high fiber foods, so vegetables, fruit, cooked dried beans, pasta, and rice. It moves food along the digestive tract. It helps control glucose, blood sugar levels. Rice is a carb, so you need to be careful with rice, but it can also help reduce cholesterol levels. And avoid overeating or foods that cause gas or bloating. It can make it difficult to breathe. Foods that cause gas include carbonated beverages, so it's very common for sodas or like one of those carbonated beverage machines that you can make at home. You can make water, carbonated water. Fried, greasy, or heavily spiced foods can cause gas. Apples, avocados, and melons, beans, broccoli, Brussels sprouts, cabbage, whatever. Everybody's different, so some foods might affect you differently. So, there's some foods that are not on our list that cause you to have gas. Then try to eliminate that or cut back on it.
Now, you may see a pattern here where when you have chronic lung disease, it helps to have a strategy in mind for all of your activity. How to conserve energy, how to manage your shortness of breath and get more done that benefits you and gives you the quality of life you want. That applies to eating as well, what you eat and when you eat. We'll talk a little bit more about that.
And controlling sodium or salt in your diet.
Hmm.
So consuming too much salt causes the body to retain too much water, which causes breathing to be difficult. This is the water retention. Helpful hints to limit daily salt intake or remove the salt shaker from the table. Use herbs or no salt spices to flavor foods. Don't add salts to food when cooking. The common theme is um, you can always add salt later. You can't take it out if you oversalt it. And then avoid foods with greater than 300 milligrams of sodium per serving. You can always look on the back, read the labels of the food that you eat.
The nutritionist and even a lot of good cooks can tell you what you can use so you don't miss that salt so much that you don't want to eat. You don't want food not to have any flavor. But besides adding salt, there are a lot of things you can do. One that I know of is using a little bit of lemon, uh, but other things as well. So you don't have to eat flat, tasteless food. We're not recommending that at all.
Now, reasons for poor nutrition with lung disease. So dyspnea or shortness of breath, um, and cough interfere with inadequate dietary intake. If you're coughing or short of breath, you're really not going to want to eat. And now fatigue, so being tired interferes with buying and preparing food. If you are somebody who likes to go to the grocery store often and make fresh food every day, if you're fatigued, you're tired from being short of breath all the time, you're not going to want to go out to the grocery store and buy food to cook for you. Chronic mouth breathing, so breathing through your mouth, if you're gasping for air frequently, it alters the taste of the food because it dries out your tongue. And then headaches and confusion can occur because of excess levels of carbon dioxide in the blood. And so if you're confused, you might not eat. You might forget to eat. So there's a vicious cycle that happens with lung disease when it comes to shortness of breath. And then you have that cycle of weight loss is one component of that cycle. So it just leads into this spiral, and we want to make sure that you are able to correct or break the cycle at any one of those points.
And turn it into a virtuous cycle. And another plug for our pulmonary rehabilitation program: exercise and managing your chronic lung disease better. You're feeling better. You're eating better. You're on a virtuous cycle.
Tips for gaining weight: drink milk instead of low-calorie beverages. Talk to your doctor or dietitian about supplementing meals with a nutritional supplement such as Ensure or Boost. Supplements can increase calories and provide nutrients to your body. Examples of calorie-rich foods include proteins or red meat, pork, chicken with no skin on, roast or broil it. Don't deep fry it, for your health. Salmon or other oily fish, beans, whole milk, eggs, cheese, full fat yogurt. Carbs, potatoes, brown rice, whole grain pasta, whole grains, whole grain bread. Fats, nuts and nut butter, olives, avocado, butter, salad dressings, mayo, high fat cheese. If you were lucky enough to attend our entire home-based pulmonary rehab class, we stress trying to get a nutritionist or a dietitian on board because they have so much more information and they're the experts in the field and they can really help guide you on the proper path.
That's right.
Overcoming shortness of breath while eating. So one thing that we always recommend is clear your airways 1 hour prior to eating, whether that's using an acapella device or a mucus clearance device, or taking a neb treatment or an inhaler treatment before, waiting a little bit, and then coughing, trying to get all that mucus up. So when you're eating, you're not also coughing. Eat slowly, take small bites, and breathe deeply while chewing through your nose. And then choose foods that are easy to chew. You're not going to want to go if you're having some shortness of breath. You're not going to eat something that's really tough to chew. Try not to get a very sinewy steak. You want to get a nice lean steak, something that's easy to chew. Cut it into smaller pieces, and instead of eating 3 large meals, try eating 5 to 6 small meals. This will keep your stomach from filling up too much, so your lungs have room to expand. Because remember, the primary breathing muscle is your diaphragm, and if your stomach fills up, it's going to push up on your diaphragm and push up on your lungs to make it harder for them to expand. Drink liquids at the end of your meal. Drinking during a meal might make you feel bloated. And then also, if you're drinking water, it's not adding calories to you, and you won't be eating the rest of your meal, like the salad on the table in the picture. If you drink a whole glass of water before it, you're probably going to have a couple bites of your salad and be like, oh, I'm sort of full, and you're not going to get to your protein. And then eat while sitting up to relieve pressure on your abdomen. So if you're sitting up, gravity will naturally push or pull your diaphragm down, and thereby expanding your thorax, so you can actually breathe a little bit easier, and also pulls your stomach down, so it actually the food will be able to go down much easier.
This is another example of using strategy for everything in your life so that you're feeling better, living better, eating better, in this case, more healthfully. One more thing about having a full stomach and the diaphragm. Your diaphragm is your primary, your most important, and most efficient breathing muscle. It's technically two muscles, but we think of it as one. If you have COPD, your lungs are probably bigger than normal because they're filled up with more stale air than would be in normal lungs. And your diaphragm is actually right above your stomach. So if your lungs are extra big, overexpanded, and pushing your diaphragm down, your diaphragm is being pushed right into your stomach. So it can be between a rock and a hard place. That hard place might be your stomach overfull. So that's why eating smaller, more frequent meals might be easier, less work, and help you get better nutrition than eating 3 large meals, because your stomach your diaphragm doesn't have that much room to move, and you don't want to fill it up too much if it's pushing up on your diaphragm and not letting it move at all. Does that make sense? I hope.
So tips for improving your appetite and diet. So choose foods that are easy to prepare. If you use all your energy trying to cook, you won't have enough energy left to eat. Rest just before eating, so take a break. Eat the largest meal with a higher calorie intake early in the morning, so a fairly nice breakfast. Avoid non-nutritious beverages, coffees, teas, and sodas. Don't eliminate them. If you like to have coffee and tea and soda, just cut it down a little bit. Eat more protein and fat, less simple sugars. Walk or other light activities stimulate appetite. Keep food visible and within reach. Choose high protein, high calorie snacks, and limit alcohol consumption. It might slow down your breathing and make it more difficult for you to cough up mucus.
And I want to give a little plug here to all of you that are watching this. We learn a lot of these things not because they were invented or thought up in advanced research in medical schools and so forth. A lot of these tips come from people who have these chronic lung diseases and have found that these things work for them. At least some of these tips might really help you as well. They've helped other people.
Keep a balanced diet. So there's choosemyplate.gov, which talks about nutritional plate and what should make up your plate in an ideal world or scenario. So choose fresh or canned fruit without added sugar. Eat a variety of veggies, especially dark green, red, and orange vegetables. Switch to fat-free or low-fat milk and other dairy products. Make at least half your grains whole grains, and choose your protein. You can vary them. Try beans, nuts, soy, and seafood. You just want to try to get as well balanced of a meal as possible. And again, if you're having problems with that, dietitians have and nutritionists have a lot of tips and tricks.
That's right.
Now, in conclusion, the things that you can eat affect the way you breathe. It's important to maintain a healthy body weight. Pay attention to how many calories you consume per day. Avoid overeating, especially we're getting around the holidays. It's a big thing about overeating the holidays. Avoid foods and beverages that can cause gas or bloating. Include high fiber foods in your daily diet. Limit sodium intake.
That's right. Have a strategy for managing your lung disease that helps you achieve the goals that you have set for your life. It can be done, and eating well, eating better, the best diet that's appropriate for you is a major part of that. Good luck with that. We hope this has helped.
And thank you for taking the time to watch our presentation and listen to us talk. Please feel free to go to our website, which is morlenhealth.com, for more information.